Good afternoon, everyone. You can tell there's a school teacher in me, as it's now 3 o'clock, and that's the time we're scheduled to start. So we will now start today's webinar town hall for BritCham members and friends. My name's Chris Jeffrey. I am chair of BritCham in Vietnam, and I'm speaking to you from Hanoi. And today we're joined by Gareth Ward, who is our ambassador, and Emily Hamblin from Saigon, who is Consul General and Director of Trade for Vietnam. So today's webinar was really about COP and also the UK Free Trade Agreement. But obviously with the situation in Saigon, as well as Vietnam generally, COVID and vaccinations will play a part as well. If you have any questions, can I ask that you please type them into the chat box whenever you want. And at the end of Emily and Gareth's talk, we'll then come to the questions and we'll try and get through as many questions as possible. So, ladies and gentlemen, without further ado, I'm going to introduce Gareth Ward, Ambassador, who is going to start today's proceedings. Gareth, over to you, sir.
Thanks very much, Chris. Can I just double check with you that I'm coming through loud and clear? Great. Okay. Well, as you said, Chris, when we envisaged this event to start with, times were a little bit easier. So I will talk about important issues in the UK-Vietnam bilateral relationship, which include COP26, climate change, our trade relationship, although I'll let Emily speak mainly on that, and also issues around defence and maritime security. But I think the issue on everybody's mind, certainly on my mind, and I know on many Brits and British businesses' mind, is the deterioration in the COVID situation here. So I'm not going to beat around the bush. I'm going to go straight into that and spend most of my time on that, and then I'll go through some of the other issues. So first of all, I can give you a view on where I think things are at in Vietnam as a whole, and to a degree in the south, although again Emily will add some flavour on that. I'm not an expert, but after a year and a half of working on and analysing the situation in COVID, I do think I have some good information flows, and obviously I'm in touch with colleagues like the Oxford University Clinical Research Unit and others, including AstraZeneca and Nitin, who's online, I know. So clearly the trends are deteriorating, and it's only since the fourth wave started in May that we've had 34,000 of the cases, of the 38,000 cases that have been through the whole pandemic in Vietnam. So that shows how things are accelerating. But numbers of deaths, mercifully, are still very low at 138. So I think we can clearly say that the Delta variant is much more difficult to control because it's faster to spread. And that is why things got out of control quickly in Bac Giang and Bac Ninh, the two provinces with lots of business parks in the north where the fourth wave started, although those provinces have managed to get it under control, which is a good sign. However, now in Ho Chi Minh City and increasingly in other provinces in the south, you can see Delta spreading fast, and I think, inevitably Ho Chi Minh City is a very different level of. Oh, okay. It seems like Chris has just messaged me to say that Zoom has crashed. So Could someone tell me if I'm still
I think we
audible or
can
not?
still hear you, and so I assume participants can still hear you too. So I think it's just Chris that we've lost. So I think you're
Okay.
good to carry on.
Thanks, Emily. I will carry on. So obviously, Ho Chi Minh City is a much larger entity than Bac Ninh or Bac Giang. So that's one of the complex factors. So in response, you can see the Vietnamese approach to COVID management is adapting. I mean, the core of the response for the whole of this 18-month period, of course, has been strong border control, very fast and effective tracking and tracing, and a lot of use of institutional quarantine. But that's no longer working, particularly the quarantine approach that they've had up to now, because numbers have increased, and also you start to see the downsides of large quarantine centres, in that you get cross-infection within those centres. So recently you can see a few measures. The first is that the reduction of quarantine from 21 days to 14 days, which is good news. This is something that we've been lobbying the Vietnamese government about ever since they introduced 21 days, saying that this 21 days was excessive, not based on the science, and also had health and mental health implications for individuals. So it's good that they've gone back down to 14 days, and that they're now looking at spreading out home quarantine for F1s, and also home quarantine for F0s, at least after the viral load has dropped below a certain level in a patient. And of course, there are the directives in place. So in Hanoi at the moment, we're in Directive 15, which is a series of restrictions, which includes shutting down essential businesses like, non-essential businesses like restaurants and hairdressers and so on, but still allowing people to go to work, and a rule of 10 here, no meetings larger than 10, and so on. And then Directive 16, of course, is in place in Ho Chi Minh City now, which is much more restrictive, and we can see that in Ho Chi Minh City, they're upping the amount of testing. I think they've managed about 2 million tests over the last few weeks. So that's an improvement. And I think that the real key indicator for us to be following is not just the number of cases in Ho Chi Minh City, but the number of cases that are not linked to existing track and trace chains. So they're not from people, the groups who've already been isolated. And it seems to be about 10% of cases that are unexplained. So if that number goes up, then that's a bad signal. If that number goes down, then it's a good signal. Coming on to vaccination, we know that in Vietnam there have been 4 million people who have had their first vaccination, and about 286,000 who've had both jabs. So that's still quite, well, not quite, it's still a very low level of vaccinations, the lowest in ASEAN, possibly. I mean, Myanmar, the data's not very clear, but that's still clearly in the low single digits for first percentage for first dose. There have been there's been quite a lot of progress in terms of attracting vaccines or getting contracts for vaccines. So there's over 100 million vaccines secured so far. That's 38 million through COVAX, 30 million through a bilateral agreement with AstraZeneca, 31 million through a bilateral agreement with Pfizer, and then some discussion with Sputnik, the Russians. I'm not sure how many that will give, and then various bilateral donations, the Japanese having come in recently with 3 million doses, the US with 2 million, Australians with 1.5 million. And the vaccination program for Vietnam has now been set out reasonably clearly with the 16 priority categories and the aim of vaccinating 70% of the population by the end of the year, which looks stretching at the moment, I have to say, because securing the doses is not the same as having them delivered on a plane, obviously. Before I'll come back into just the implications on the vaccine side a bit more in a minute, but my general assessment is that lockdowns do have effect against the Delta variant. That's been shown elsewhere. So it's not, it's not time to lose hope or give up. I'm sure the Vietnamese government will not be giving up on the lockdown approach for now, because it's worked quite well over 18 months. However, the Delta variant within Ho Chi Minh City is spread much more widely than in any previous example. So it's too early to say whether that's, well, it's certainly not going to, lockdown's not going to work in the next weeks. It will take months. And it may not be possible to get back to a sort of zero COVID environment. It's good that Vietnam is able to mobilize resources from other parts of the country, just in the same way that resources were mobilized to help Da Nang, to help Bac Giang, Bac Ninh. Now resources are being mobilized to help Ho Chi Minh City. So 10,000 healthcare workers, that's good news. Probably the best piece of news against this background of not very good news is that there are only about 120 people currently in critical care on ventilators or other critical care in Vietnam. So consider that, against a caseload of 34,000, that's quite low, that's very low. That's good. That shows that if the situation were much worse than the figures were showing, there would definitely be more people in a critical situation. And that also means that whilst the healthcare system is under strain, particularly in Ho Chi Minh City and maybe some other southern provinces, it's not near breakdown. So just going back a bit more to vaccines and to British nationals in particular, the 16 priority groups for the Vietnam vaccination program, we've lobbied several times with the Vietnamese government that their vaccination program should not discriminate against foreigners. They've told us privately that it won't do. Now they've said publicly a couple of weeks ago that there will be no discrimination against foreigners. Foreign nationals will be included in the program. And the early evidence is that quite a number of Brits are getting vaccinated under the Vietnamese program. Mainly in terms of the people I've come across in healthcare and education sectors, but I'd be very interested to know from others on this discussion if that's yet spreading wider. As you go down the list of priority groups, there are priority groups for people over 65 and priority groups for people with healthcare conditions. So that's good. I don't think that the rollout has really started amongst those groups. It's mainly in the groups that are higher up the prioritization list at the moment, but at least those groups are prioritized, which means they will get it ahead of the main population. And then there's a category of residents in pandemic hit areas as well. So we've seen that Vietnam is sending vaccines to provinces that need them most. It's not a countrywide rollout. So I think a quarter of all vaccines so far have gone to Ho Chi Minh City, and I think that percentage will stay there or maybe even increase. So that's also good news in the sense of targeting. Most Brits are in Ho Chi Minh City. There's a website which has gone live for registration for individuals, but it's not yet in English, and it doesn't yet have the correct fields to fill out, as I understand it, for foreign passport holders. So they've promised that they will update that website within the next week or two. So our suggestion is to keep looking at that website until it's updated and individuals can register on it. Just on the consular side, there are quite a lot of things going on, which I'm sure you're all experiencing. There's not just COVID, there's also the change in visa policy. So I know it's difficult for quite a few Brits. We're getting some feedback from Brits here, particularly those who are here on tourist visas. I mean, we've always said that you should only stay in Vietnam if you're here legally and you're here with the right visa. And if not, then you will have to leave. And I know there's quite a trickle of Brits who are leaving, who are here on tourist visas. But I know there are some blurred boundaries and some difficulties that people are experiencing in renewing their work visas. So I'd be quite interested in hearing about that. We have not recommended against travel to Vietnam throughout the whole pandemic, but we did advise at the beginning for tourists to leave as soon as possible, which the huge majority of them did. For residents here, we said that if you have networks, support networks, so if you have resources, financial resources, and people networks, then it was safe to stay, and that's still our position. But of course, every situation is individual. So we are dealing with a steady flow of Brits who are leaving either due to the work visa issue, as I just mentioned, or who have a particular vulnerability, so a health vulnerability or a mental health vulnerability, and we're helping them to leave Vietnam. So our consular support approach is very much vulnerability based. We target our support to those people who are in the most difficult situations and have the least resources to deal with them. And as I say, there's quite a few cases of destitution and mental health. So that's quite a lot that I've talked about on COVID and consular, but I'm conscious that's probably the hot thing on people's minds. Let me just quickly now go through a few of the other issues before handing over to Emily. So as Chris mentioned, COP26 is our top policy priority for the year in Vietnam and globally. That's the climate change agenda, and that's encouraging Vietnam to increase its ambition, both in terms of emissions reductions and a net zero target year, and also reduction in coal usage. So those are we've had high level visits by the president of COP, that's Alok Sharma, speaking to the Prime Minister and many other ministers here, and giving this message about being ready to support Vietnam, both on the mitigation, i.e. reducing emissions, and that's primarily energy. We're talking about 70% of emissions in Vietnam come from the energy sector, and so stopping building new coal-fired power stations and building more renewables is the single most important thing for Vietnam. We've also been working a lot on adaptation, so helping parts of Vietnam to adapt so that they are more resilient to climate risks, whether that's the poorest people in the central coastal areas or central highlands who need flood-proof housing, or whether it's the working on flood management systems in Ho Chi Minh City, or adaptation plans in the Mekong Delta to deal with salination. Also, we have a focus on nature and biodiversity, and we've got some big new programs in the pipeline on that, particularly around forest protection and biodiversity protection. But most of the British ODA, Overseas Development Assistance, is going into funds that can help green infrastructure or energy infrastructure in Vietnam, particularly the grid. I'm happy to answer more questions about COP26. We're just a bit more than 100 days away from COP26, which we expect Prime Minister Chin to attend in person, as that should be his first big visit overseas. trade and Cptpp, I will leave to Emily. A final word on maritime security. We expect to have the Defence Secretary visiting Vietnam next week. That will be the first ever visit of a British Defence Secretary to Vietnam. He's travelling to the US, Japan, Korea, and Vietnam, which I think is quite interesting in and of itself. You know, the US obviously our closest ally, Japan and Korea, very like-minded partners who we've worked with for decades in the region in defence issues, and then Vietnam, who is not our traditional defence partner. Our defence relationship here is quite young, but we're particularly focused on maritime security and on freedom of navigation, protection of UNCLOS, and as you're all no doubt aware, the HMS Queen Elizabeth, the carrier strike group, our new aircraft carrier, is just arriving in the region, in Indo-Pacific region. I think she's somewhere near Thailand and Singapore at the moment, but she'll be in the region for several months and visiting various countries in ASEAN. So that's a strong signal of our commitment to regional security here. And again, I'll be happy to answer any questions on that issue. So I think that's all from me. I hope I got the balance right by going heavily into the COVID related issues. If not, I'm happy to speak more on the other issues later. So I'll hand back to Chris or straight to Emily. Chris, tell us.
If you don't mind, Gareth, sorry, Gareth. If you don't mind, just to reiterate, if you have any questions, please do feel free to type them into the Q&A. So far, Bill, Matthew, and John have, and we'll cover those after Emily has spoken. So without further ado, Emily, over to you.
Thank you very much, Chris, and thank you, Gareth. So for anyone that I haven't met, I'm Emily Hamblin, the Consul General down here in Ho Chi Minh City and the UK's Director for International Trade in Vietnam. And I was thinking I would just, obviously Gareth has covered the COVID-19 situation in some detail, but I thought I'd just add a few thoughts on that, specifically from a Ho Chi Minh City perspective. And then, as Gareth said, I'll also expand a little bit on what we're doing on trade, on bilateral trade and growing the bilateral trade relationship. As Gareth said, likewise, I am not a particular pandemic or expert or doctor, but I'm speaking regularly to many of the international experts based down here in Ho Chi Minh City in particular, as well as the local authorities. So we'll do my best to share some of that here now. In terms of the overall trends that Gareth has already talked through, I think in terms of how that applies down here in Ho Chi Minh City, clearly the situation continues to deteriorate, as Gareth said, and the numbers are still going up here in the city itself, as well as now in several of the surrounding provinces too. And we have nearly 20,000 cases now in Ho Chi Minh City. And whilst there has obviously also been a big increase in testing over the last couple of weeks in Ho Chi Minh City, so some of that might make the curve look steeper than it would be just on the basis of increased transmission. I think even adjusting for that is clearly a steep rise in the number of cases over the last few weeks. And in terms of measures and bringing that situation under control, you know, I think as Gareth has set out, it's essentially kind of two ways of doing that. One, which is around slowing transmission by bringing in restrictions such as lockdowns, and the other is through reducing the vulnerability of the population through increased vaccination, which obviously takes time. As you'll all be aware, here in Ho Chi Minh City, for several weeks now, we've had forms of partial and targeted lockdowns, and we're now on day 7 of Directive 16, a citywide fuller lockdown, which is currently in place. And then we also had an announcement from Chairman Fung 2 days ago on the 13th of July that from today, businesses, particularly manufacturing businesses, need to either be able to keep all of their staff on site or at a separate location with secure transport in between in order to remain opening. So that was some further restrictions brought in from today in terms of businesses that can continue operating in the current restrictions. In terms of the kind of pressures on the health and hospital systems down here, as Gareth said, I think the health system clearly is under pressure, as you'd expect, with numbers of cases that high and with policies that have until recently involved putting everybody who is infected, who is F0, in a hospital setting, even when they are asymptomatic or not seriously ill. So I think it's positive to see that position is shifting now to allow some F0s to remain at home to take some of the pressure off the health system, and I'm hearing that being applied in situations here now. I think, yeah, echoing what Gareth said, my sense is that from the kind of people I've been speaking to, that there is a kind of urgent requirement for more vaccines, and the authorities are very focused on ramping up the vaccination and also for testing and testing equipment. But currently, in terms of critical care and critical care machinery and supplies like oxygen, those are currently holding up. Okay, so that's not a kind of health situation that's collapsing in that respect, which is positive. Again, as Gareth said, I think it's likely, you know, from what we've seen, including most recently with the outbreak up in the north, which is also the Delta variant, and with other Delta-driven outbreaks globally, restrictions and lockdowns can work with the Delta variant, despite it being more transmissible. They do ultimately work to bring situations under control, but it's likely, you know, the situation here in Ho Chi Minh City is widespread, complicated, challenging one. So it is likely to take several weeks, most likely months of restrictions in order to bring numbers under control. And of course, even when this outbreak is brought under control with low vaccination rates across the country, that vulnerability to future outbreaks would remain. In terms of vaccinations and some of the messages at a city level, to reiterate that also at a city level, the authorities have been very clear that foreign nationals will be included in vaccination programs, and they have been so far. They made that point again recently at a meeting that the authorities called with the diplomatic corps and the international chambers of business that BritCham was also represented at. And they were they very much emphasised the fact that foreign nationals would be included. In terms of the next wave of their vaccination campaign here in the city, that will begin on the 18th of July. And for that vaccination campaign, they have, my understanding is they have around 55,000 doses of Pfizer, 100,000 doses of AstraZeneca, and 1 million Moderna doses. And they've set out 5 of the categories that they'll be prioritising for that campaign, which includes the old, the vulnerable, the poor, health and food workers, and also a category called foreign workers. So we are pushing with the local authorities for some more clarity on what that final category of foreign workers will mean in practice and how they will identify who qualifies under that category. But they are planning, as I say, to launch that stage of the campaign on the 18th of July and be vaccinating across 630 different points across the city, being run by local healthcare workers and vaccinating, I believe, at a rate of 120 people per site per day. Gareth mentioned already the national online registration system that has been set up and that we have been told will be available in English, and for foreign nationals to be able to enter things like passport ID numbers shortly, but currently it doesn't have that functionality. So we're hoping that will be available soon. The local authorities here, and in particular the Department of Industry and Trade here in Ho Chi Minh City, also launched yesterday a request for representative officers of foreign invested companies in Ho Chi Minh City registered in Ho Chi Minh City to come forward to register for vaccinations. That came out via chambers, and I know that BritCham has circulated that out to members. There have been some difficulties with the form and with the information and the timelines, which I know BritCham are raising directly with the Department of International Trade, but which I'm also raising through my channels to try and get clarity on what exactly is needed, and to make sure that our British businesses are able to enter the information through that system as well. I think that was all I was going to add in terms of additional information on COVID-19 from a Ho Chi Minh City perspective. I'll also just speak briefly about trade and what we're doing on progressing the bilateral trade relationship as part of our overall work to strengthen the UK-Vietnam relationship. So, I think this is a really big focus on both sides. There's very high ambition, both from the UK and Vietnam, to keep growing and strengthening our bilateral trade relationship. I think we can see that in the fact that in the last 10 months, as well as 2 visits from the Foreign Secretary, we've also had 2 visits from our Minister for Trade Policy and a visit from our Secretary of State for Trade, at a time when there is not much international travel going on. And I think that shows the level of focus and commitment to this from the UK government. I think the bilateral trade relationship has been on a really strong growth trajectory. Over the decade running up to 2019, that relationship tripled. And so there's a clear desire to keep that trajectory going into the future. And in terms of specifically how we are supporting that, I'll talk briefly about the UK-Vietnam Free Trade Agreement, and then about Cptpp, and then about some of our key sectors where we see the highest level of opportunity for growing UK exports to Vietnam in particular. So in terms of the UK-Vietnam Free Trade Agreement, hopefully many or all of you will be aware of that already. So we transitioned the EU-Vietnam Free Trade Agreement that came into effect about a year ago into a bilateral agreement, and it was provisionally applied from the 1st of January of this year, and then legally entered into force at the beginning of May. And I think that was a really important milestone, and is an important platform for continuing to promote bilateral trade. Not least because it ensured certainty for businesses on both sides as the UK exited the European Union, but also because of the concrete benefits that it secures. So, for example, the Free Trade Agreement, it delivers significant benefits in terms of tariff reductions and eliminations. So it already means the removal of 65% of tariffs, and that will increase to 99% by full implementation, which is between 6 and 9 years, depending on the categories of goods. And that's important both for some of the biggest imports into the UK in areas like clothing, footwear, seafood, which guarantees continued access to UK businesses and consumers at lower prices, and also for some of our major exports here in areas from machinery to pharmaceuticals to alcohol and cars. But the FTA does a lot more than just tariff reductions as well. So it includes some significant commitments in terms of addressing non-tariff barriers to trade. So this is things like technical barriers to trade and regulation. So the FTA includes commitments for both sides to be progressing and converging towards international standards, which gives more predictability and certainty in terms of the types of standards that you're going to be held to account to in different sectors and on different products. So that is really important too. And it also includes significant commitments on services, including Vietnam opening up some service sectors beyond what it does for other countries who are just operating under WTO commitments. That includes, in services from areas like nursing and medical personnel through to parts of financial services, and cross-cutting benefits, for example, on areas like e-commerce on opening up government procurement, on improved protections for intellectual property, and also in terms of broader commitments to the types of sustainable development that we are really committed to in the UK. So areas from labour laws and workers' rights through to environmental commitments. So I think the UK-Vietnam FTA is a really important milestone. With my team, what we're now focused on is promoting it to make sure that businesses know about it and know how to access the benefits, as well as addressing any kind of short-term implementation issues that businesses might be facing to make sure that they can access the benefits, and then setting up the right structures for the longer term to ensure that we have the right channels of communication to make sure that the commitments are fully implemented and we can hold each other to account to that on both sides. So that's what I'd say on the FTA. In terms of Cptpp, so Cptpp, that's the Comprehensive and Progressive Agreement for Trans-Pacific Partnership, which again, I'm sure many of you would have heard of, but essentially it's one of the biggest free trade areas in the world. It consists of 11 member countries currently, 4 of which are here in Southeast Asia, including Vietnam, and the UK has a really clear ambition to join that group and to accede to Cptpp. And that's for several reasons, one of which is that we think at a kind of strategic level, it sends an important message about the importance of free and fair trade and trading, adhering to rules. So it's important in that respect. And then more concretely, the benefits from Cptpp include removing 99.9% of tariffs. It includes, it's a really high standards and deep agreement. So it goes beyond several existing what's in several existing free trade agreements in terms of particularly areas like services and digital. And that's by making it easier for business people to move around, making it easier for data to flow and things like that. But I think the key advantage of the Cptpp, as I see it, is the fact that it is a network of countries and it's a network of some of the biggest economies. So, combined, the 11 members already account for 13% of GDP. And if we join, that will go up to 16%, which means that businesses who are wanting to operate global supply chains that cut across several different markets, Cptpp will provide a much easier way to do that in several situations. So in terms of the next steps on Cptpp, we have published our initial kind of outline position. The Cptpp members are pulling together an accession working group, which will meet for the first time shortly. And after that, we will make a market access offer and the negotiations will begin in earnest, and we're looking to progress them really quickly and at pace. Finally, I was just going to touch on some of the sectors where we see the highest level of opportunity for UK businesses here in Vietnam. So that is sectors like renewable energy. Gareth has already mentioned climate change and COP26, but we see a huge opportunity for Vietnam here, not just in bringing their emissions under control, but also in terms of transitioning to renewable energy. And that's a huge business opportunity. They've got great natural resources in solar and also areas like wind. And the UK is a world leader, particularly in offshore wind. And so we've got a lot of expertise to offer. So that's a key area of opportunity. Health is another one I would mention, from pharmaceuticals, which is currently one of our top exports to Vietnam, through to broader healthcare offer, where demand is growing for high quality healthcare provision here. And there are local gaps in terms of what's on offer that the UK is well placed to help fill. Education, a key export for us, both in terms of attracting Vietnamese students to the UK, but also offering UK qualifications and study with UK institutions here in Vietnam, all the way through from school to higher education, to vocational training, and particularly in areas like English language. Others I could mention would include infrastructure, financial services, professional services, tech, including agri-tech. And in each of those sectors, what the team is focused on doing is both connecting businesses to specific opportunities, but also understanding what are the challenges that they face in operating in those sectors here, and then using our channels into government to lobby for action to be taken on those. So, and for example, we have an annual meeting between our trade ministers. The next one's coming up at the end of September, which we use as an opportunity to raise these issues at the highest level, as well as the action that's taken week by week in between. Anyway, I will stop there. Very happy to take questions on any of the trade agenda, or I think possibly more likely COVID-19.
Thank you, Emily. Thank you, Emily and Gareth, for that. Excuse me. Please do remember, if you do have questions, just type them into the box and we'll come on to them. And I will be MC of questions. So I think the first one is really about, surprisingly enough, vaccines and COVID. And in terms that the British government appears to be slightly or a long way behind other governments about supporting Vietnam directly with vaccines, as well as prioritizing UK citizens and UK business. Is there anything that either Emily or Gareth can add to what you've already said about that?
Sure. Chris, can you hear me? I can answer those questions.
Emily, Gareth? Good.
Okay. Great. So I wouldn't agree that we're a long way behind others in terms of helping Vietnam's vaccine rollout. We are the third largest donor to COVAX, which is the UN mechanism. I think the US is ahead of us and the EU are ahead of us, but obviously the EU is a large group of countries. So we have committed 550 million pounds to COVAX, of which a good proportion is coming to Vietnam. I can't tell you off the top of my head. I mean, there are 120 countries that are getting vaccines from COVAX, but as I said, Vietnam will get 38 million doses from COVAX, and the UK is providing a substantial proportion of the funding for that. Also, at the G7 summit a few weeks ago, our Prime Minister Johnson announced that the UK would give 100 million excess doses that we don't need in the UK to the international community. 80 million of those will go to COVAX. So that again means that some of those doses will come to Vietnam. And then there will be 20 million excess doses that will be given to partner countries. We haven't yet allocated those doses. I'm in touch with London about it. So I think it's just a question of watch this space. But we are already, apart from Japan and the US, I would say we're already the largest donor of vaccines to Vietnam, but that's through COVAX. And of course, the UK government did support AstraZeneca in its research and development, which has allowed AstraZeneca to provide doses at a very good rate and a no profit rate to Vietnam, which is not the case for the Pfizer and other Moderna doses that Vietnam has got. In terms of supporting British citizens, so our policy globally is to encourage host governments to include British citizens and all foreign citizens equitably and in a non-discriminatory way into the national programs of vaccination. So, effectively we're saying Brits should get vaccines at the same time as Vietnamese, depending on the groups that are identified as priority. Of course, in the UK, it was all done on an age cohort basis and a health vulnerability basis. Here, it's a bit more of a complex matrix. As Emily just described, there are several more categories. But I would be concerned and would be lobbying very, very hard with the Vietnamese government if they had not been shown to be delivering to foreigners, vaccines to foreigners, but we believe they are, and so we think that process is going to benefit British citizens. If we give vaccines to Vietnam, they are funded through UK overseas development funding, and that's the primary benefit of that has to be to the host nation. It's not for primary benefit of the UK. That's that's the legal definition of ODA. So funding, being frank, the country which has given donations to Vietnam and then said you must vaccinate our own people is China. That's not the way we operate. That's not the way the US operates. It's not the way the Australians operate. We don't give a gift, a donation, an aid donation, and then put stipulations that it has to benefit Brits. So I know that's a frustrating message to individuals who have not yet been contacted by the Vietnamese system to get their appointments in place. But that's the global policy. And whilst there are probably only a couple of thousand Brits in Vietnam, and it might seem possible to do something logistically easily for that group, there are hundreds of thousands of Brits in Thailand, for instance, and we can't have a policy which we can't apply globally. So that's why we are where we are. And sorry if I'm being blunt, but that is our policy. I want Brits to get vaccines quickly in Vietnam, but again, I don't want Brits to get vaccines ahead of the queue in Vietnam from vaccines that are being donated to Vietnam.
Cool. Thank you very much, Gareth, for that. And in terms of somebody who works in education in Hanoi, and I know it's the same in Saigon, because they're a priority group, they are being vaccinated with the first dose, and that has been done, as far as I'm aware, here in Hanoi, as well as Saigon, that it doesn't matter on where your passport is from. So it is happening. Obviously, all of us want it to be quicker, and there are a lot more vaccines coming in. And perhaps if everyone's happy, I could ask Nitin just to give an overview of vaccines coming in. And also, Nitin, there is a question about the Indian AstraZeneca vaccine, and will that be recognized by Vietnam? Personally, I didn't think there was any difference, but perhaps you could explain.
So thank you, Chris. Thank you, Gareth, Emily, for a very good overview. I don't think I need to go over the same things or repeat the numbers again, but I think it's fair to say that Vietnam has secured now over 100 million vaccine, actually close to almost 120 million vaccines already, which is pretty remarkable. A bulk of that will end up in the country this year, and then there'll be some spillover in the early next year. Till date, more than 4 million people have been inoculated. This morning, another shipment of about 920,000 vaccines arrived in Ho Chi Minh City airport. It doesn't mean it's all for Ho Chi Minh City. The country will then divert and manage as per national vaccination campaign. So vaccines are coming in. To date, I think as of now, AstraZeneca, including this morning's shipment, the total AstraZeneca vaccines in the country is almost close to 6 million now. So vaccines are coming in, and I think as the vaccines start to flow in between AstraZeneca, Pfizer, Moderna, and so on, we will see a pretty aggressive inoculation program from the government, which is already happening, and we can see it. Specific to the question Chris raised on the chat, to my knowledge, there was a very small batch of about 500 vaccines imported by WHO under United Nations program. Those vaccines were administered by a reputable clinic, and those certificates would be valid by UN and as well as from that clinic. That is to my knowledge here. And there is no other SII manufactured vaccines coming in. It was just a special small arrangement by UN directly. Hope that helps. Yeah.
Thank you, Nitin. And I should just say Nitin is president of AstraZeneca here in Vietnam, if nobody knows him. Sorry, I'm so used to seeing your face and your voice talking about vaccines and COVID that I assume every single person in Vietnam recognizes you, Nitin. So, but Nitin has been a great supporter of BritCham, as well as supporting the health sector here in Vietnam and advising both government in Vietnam as well as the embassy and the consulate. There is a question from an anonymous person, I will say anonymous, called Bill, who says he's very old, i.e. over 65, and unfortunately he lives in Saigon, but his company is registered in Hanoi, and really about how those sorts of situations or anomalies will be dealt with. So I think on behalf of BritCham, we'll certainly take that up and work with both the authorities in Hanoi and Saigon. In terms of other questions,
Chris,
the majority, sorry, yes, Emily.
Sorry, I didn't mean to interrupt. I think I have a slight time delay. I was just going to say, I've also noted down that question because I think particularly in respect of the request from the local Department of Industry and Trade that came through yesterday, that is exactly the type of thing that we are trying to urgently clarify with them on our side as well, as I know you're doing through the BritCham channels too. So just to confirm that I have noted that down to add to our list of questions that we're talking to them about, and we'll try and get some clarity on that because, as you say, some businesses with people based down here will clearly be registered up in Hanoi, so that does need to be taken into account. The only other thing I was just going to say in respect of the preceding questions as well was just the flag that you know, as Gareth said, as well as the UK government supporting the Oxford AstraZeneca development of the vaccine from the beginning and supporting equitable distribution via COVAX and lobbying here to make sure that foreign nationals are included in the vaccination programme. I just wanted to flag that includes at the very highest levels. So, you know, during the last ministerial visit from our Foreign Secretary and Minister for Trade Policy, the BCAC, the British Corporate Advisory Council, representatives from BritCham spoke directly to the Minister of Trade Policy to convey some of the issues around vaccinations and concerns and so on. And I know that I think the Foreign Secretary raised it in very high level meetings as well in terms of making sure foreign nationals are included and encouraging the speeding up of the vaccination programme.
Thank you, Emily. And just to also let everyone know, we had a meeting with Vietnam Business Forum Board yesterday in Hanoi with the FIA and the Foreign Investment Agency. And again, it was brought up and a letter is going forward, which will be supported by MPI, the Ministry of Planning and Investment, about vaccination for foreign invested companies and the priorities and making sure that they are dealt with fairly throughout the whole country. So it's a multi-pronged discussion, but like all things, it will come together. It's just when, I think, and none of us will be able to tell you when that is yet. But we will update you through the newsletter, and obviously the embassy and consulate through the social media channels, as well as via email from BritCham as well. I think those kind of sum up the questions related to COVID. So before we finish, it would be fantastic, Emily, to get your input on a couple of things. One would be about climate change and the business opportunities in terms of sustainable business and energy, etc., and how you think the UK, there are opportunities for UK companies to work in that sector here in Vietnam. And especially NGOs, sorry, I forgot that part of it, especially working with NGOs and supporting NGOs.
Great, thank you. So I talked a little bit about climate change and the business opportunities, but I talked in quite a narrow sense, in one sense, I guess, about the potential for the transition to renewable energy here in Vietnam and the opportunities that creates for British businesses, particularly in terms of accelerating the adoption of solar, and even more so in the future, wind and offshore wind in particular. But I think the opportunities for business linked to the climate change agenda go much, much broader than that. You know, as part of our leadership of COP26, we really see a role for all businesses to play in taking the lead in tackling climate change. And one of the key initiatives that we're promoting in that respect is called Race to Zero, which is an initiative that businesses across all different sectors, and actually other organisations as well, can sign up to, and in doing so make clear what their intentions are in terms of tackling their own climate emissions and getting themselves to net zero, and then committing to regularly monitor and report their progress against those ambitions. So I think that's a really important and useful initiative in that space. The other thing I think in Vietnam, in terms of the business and climate change agenda, that is a really key opportunity, is that Vietnam is such a manufacturing hub, and at the center of you know, increasingly at the center of global supply chains, particularly in things like clothing and footwear, we mentioned earlier, other areas like furniture as well as some higher tech around things like mobile phones. And so we know that many big international global companies have manufacturing sites here in Vietnam, and many of those are signed up to something called the RE100, which is the Renewable Energy 100% initiative, where they're committed to getting to using 100% renewable energy. And so those are companies across all different sectors, and actually all different nationalities of business as well. And so we've been working with them and with renewable energy providers and the Vietnamese government to see how we can accelerate the overall transition to renewable energy, to enable those, to support those companies in going green more quickly, but also with things like the DPPA, the Direct Power Purchasing Agreement that the Vietnamese government will be bringing in, which would allow those companies to connect directly with renewable energy providers. And I think that's such an important part of the global challenge, because consumers in places like the UK really care about this now, and the products that they're buying are often produced in places like Vietnam. And so it's really important that action is taken there. In terms of the NGO point and businesses working with NGOs, yeah, I think we have a lot of examples of British businesses already proactively doing that, both on the climate change agenda and on broader sustainability agenda as well. And that's really, really positive to see. And we're also partnering between the UK and Vietnam, for example, through some of our education and research institutions, to join forces to do research into the impacts of climate change, particularly, for example, in the two major deltas, the Mekong Delta and the Red River Delta. So that's just to give some examples. Gareth may have others that he'd like to add.
Gareth, you have your hand up, sir.
Yes, I did want to say on the NGO point, I think it's worth remembering how important Vietnam is in terms of nature-based solutions to climate change and biodiversity and forestry. So I would really encourage any businesses that are engaged at all with wood products. So, you know, if you're in Vietnam is a hub for furniture and other production, and making sure that we are meeting or encouraging supply chains to meet high standards of forestry, and also working with NGOs that are protecting forests in Vietnam. Also, I think there's a really important dimension on mangroves. The south of Vietnam has a lot of mangroves, and mangroves are even better than forests at being a carbon sink. And the future for many parts of the Mekong Delta will be in doing aquaculture in the mangroves, so sustainable aquaculture, you know, farming shrimp in the mangroves rather than farming shrimp in plastic tanks. And also all the programs and projects that are linked to sustaining habitats within Vietnam for the amazing biodiversity here. You know, it's a pretty good indicator of overall environmental and ecological health if you've got some of these key species. I mean, we all know about the rhino and the elephant as these iconic species in Africa, but Vietnam has some of the most important primates in the world, about 6 or 7 species of primate, which are very close to being endangered. So I think there's a lot of scope to cooperate with NGOs working in those spaces to make sure that we've got a good business credibility on the nature-based solutions. Thanks.
Thank you, Gareth. And really, Emily, if I can just give you a last question on Cptpp. And the question is, it's great, but will there be any setback to British business here in Vietnam? Anything which could hinder by having both agreements?
Thank you, Chris. You were breaking up a little bit, but if I understood it correctly, it was Cptpp. Can you hear me?
Yes, I can hear you.
Great. You were breaking up a little bit, but I think I understood the question was about Cptpp, and are there any kind of downsides for businesses here in signing up, and how does it sit along the bilateral FTA? So I'm going to assume that's right, and tell me if not. So I think essentially when Cptpp comes in, businesses will have the option to either apply the schedules and the agreements under the bilateral free trade agreement, or those under Cptpp, or those under standard WTO agreements, and they will be able to kind of choose between them. So in that respect, I don't see there as being a particular downside, because you can then choose what is most advantageous for you, which might depend on where you get it will depend on things like the tariffs that you face, but it might also depend on local administration procedures, and particularly if what you're doing in your business is operating across several different markets, then it might give you an advantage to be using Cptpp if those markets are all covered versus the bilateral in other situations. So I think it gives another set of options. So I wouldn't see there as a particular downside there.
Thank you very much. In terms of the questions, I'd like to thank everyone who has written a question, and we will refer all questions to the consulate and to the embassy as well. They'll have copies, and anything related to BritCham will answer directly to the membership and to the person concerned. There was one comment from John coming back about COVID and the vaccine, about a potential business paying 4 times as much to the UK government, getting 1 vaccine for us and 3 or 4 for Vietnam. And it's something that the Chamber has discussed. And the issue, as Emily and Gareth pointed out, is that it has to be a global or at least a regional approach. And the government has decided on its global approach, which is donating through COVAX, but also this, I think it was 20 million doses that will go to specific countries. So, John, we have discussed that with government. And again, it was brought up with the minister as well. And it's not part of the British government agenda at the moment. But like everything, things change, and we will constantly work with the embassy and the consulate on pushing UK interests in terms of the membership, but also business here in Vietnam, and ensuring that we're all looked after fairly. So our time is up. I know Gareth has another event or another meeting he has to go to. So without further ado, I'd like to thank everyone for participating. Thank you, Nitin. Thank you, Emily. Thank you, Gareth, for sharing. We will do this again. I know the answers aren't always the answers we want to hear, so rather than listening to other people talking and not necessarily getting the full picture. At times like this, there's a lot of gossip going around and lots of tales about what other things are happening. So I think it's very important that we stay focused on reality rather than hearing what's going on supposedly. So on behalf of BritCham, thank you very much, Gareth. Thank you, Emily. Thank you, Nitin. On behalf of BritCham, to all members, whether you're in Saigon, Hanoi, or anywhere else in Vietnam, please do stay safe. I know restrictions and lockdowns are tough, but they are there for a purpose, which is to protect us all. So please do stay safe. If there's anything you need from the Chamber, please feel free to contact the Hanoi office or the Saigon office. And likewise, stay alert to the social media of the consulate and embassy, and they'll update you on any changes. So thank you very much, everyone. And thank you for joining membership. And please join again to the next webinar. Thank you.
Thank you.
Thanks, Chris.
Bye-bye.
Bye-bye.
Thanks all.
Thank
Bye-bye.
you all. Bye.